the quality of the waiting time compared to Canada. The Australian Institute of Health and Welfare, in terms of its latest hospitals data, shows that the average waiting time for elective surgery in Australia is 49 days, 7 weeks. So if you're talking about Canada, one of the things that really staggered me when I was preparing to come over here is that the length of the waiting times that you have, not just for operations and procedures, but to actually see the specialist to be assessed in the first place. It's just extraordinary.
So thanks for joining us. You know, in Canada, the conversation around healthcare a lot of the time centers around, it seems like two options. People will say, well, Canadian healthcare is not perfect, but at least it's not like the US. Well, it may surprise you to learn that there are in fact, other countries in the world than Canada and the US. And we're going to learn a bit more today about one of those other healthcare systems, Australia. So I'm joined today by Terry Barnes. Terry, thanks for joining me.
Pleasure, Dom.
Yeah, so Terry, real quick, why don't you just tell me a little bit about yourself, the work you've done in Australian healthcare?
Well, I'm a public policy consultant now, but for 20 years I was a bureaucrat in the Australian federal bureaucracy, including as a senior executive in the Department of Health. I spent 2 stints as a senior policy advisor to Australian government health ministers, including Tony Abbott, who went on to become Prime Minister. He survived me, I think. But yes, I've been around the sector in one way or another for 30 years. I've advised in it, I've consulted, I've been a bureaucrat. I've been a commentator as well in terms of particularly doing writing and op-ed commentary on the state of the health system and politics in general around it.
Yeah, okay. So let's say I'm your average everyday Australian and maybe I have a bad hip that's in need of a replacement. What's the process like? What are my options in Australia for healthcare?
We've really got 2 streams. I mean, you've got a public stream, which would be that your GP would refer you to a specialist who would put you on an outpatient's consultation list, and then when you're seen there, you would be put on a public patient waiting list. So that could take some time, but if you're a private patient, if you're privately insured usually, if your specialist recommends you need a hip replacement and need it pronto, you're likely to get it pronto within a matter of days or weeks. So, but the public system generally works pretty well, partly because private surgeons and specialists actually operate in the public system as well as the private system. But if we're talking about the quality of the waiting time compared to Canada, the Australian Institute of Health and Welfare, in terms of its latest hospitals data, shows that the average waiting time for elective surgery in Australia is 49 days, 7 weeks. So if you're talking about Canada, one of the things that really staggered me when I was preparing to come over here is that the length of the waiting times that you have, not just for operations and procedures, but to actually see the specialist to be assessed in the first place. It's just extraordinary.
Yeah, people will wait months or even years here. You say 7 weeks in Australia.
That's an average, so obviously they're going to be outliers. But then again, they're going to be people who are going to be seen very, very, very quickly. So yes, but the public system does work well, but it does benefit. It's actually, I think it's integral that private proceduralists and surgeons actually are prepared and willing to work in the public system for public patients as well as do their private work.
Yeah, so there's this idea that having a parallel private system takes pressure off of the public system. And so it sounds like, based on the wait times and all that it sort of works that way in Australia.
Oh, it absolutely does. I mean, if you look at the workload of the private hospital sector, which is very extensive in Australia, 42% of all surgical episodes are done in private hospitals. The bulk of elective surgery, particularly things like hips, eyes and knees, are done in private hospitals. And they're subsidised, well, obviously paid for in most cases by private health insurance, which is subsidised by the federal government. Because we did some research years ago, but it basically concluded that each dollar of subsidy to private health insurance premiums actually saved $2 of state or federal healthcare money. So there was 2 for 1 offer. But certainly I think that the private health choice is something that Australians value. really, they also value Medicare, the public health insurance system. Everybody around the world seems to want to call their systems Medicare, which is very confusing. But I think we have a good hybrid. It's not perfect, far from perfect in fact, but I think it's a good hybrid of public and private. But if the private system disappeared tomorrow, it would be end of civilization as we know it in Australia, because, as I say, the workload that it takes in terms of meeting the demand for elective surgery in particular, but surgical care in general, and hospital care, is so extensive that the public system would collapse if the private sector disappeared tomorrow.
Wow. One of the things that's often brought up in the conversation in Canada is this notion that if a private system were introduced or more fleshed out in Canada, that doctors, nurses, all those resources from the public healthcare system would wind up in the private system, and you'd have a negative effect. You know, people who don't have the money to pay might be hard up. Their care might get worse. But again, in Australia, it doesn't seem like it works out that way.
No, it doesn't, because as I said, proceduralists work in both sectors. It's far less well remunerated doing the public work, but that is counterbalanced by the lucrative private work, including a compromise deal that has evolved over time, where private specialists and surgeons have rights of private practice in public hospitals if they do that public work. So I think there's that quid pro quo, but I think also, because of the way that medical specialists are trained, there is an altruistic obligation that many of those doctors, I think, feel that they want to put something back into the public system, because obviously doctors, particularly going through teaching hospitals, I mean, spend a lot of time in the public sector, and the public sector spends a lot of time and money on them. So there is, I think that quid pro quo is basically working. As I say, nothing is perfect, but I think it's a mixed system that works relatively well. And to be honest, I think if Australians actually saw some of the statistics in terms of the performance of Canadian healthcare, particularly around waiting times to see a doctor, to see a specialist, even seeing a GP, would be absolutely flawed, absolutely staggered, because we tend to think that our system is clunky and imperfect, and we wait too long and it's too expensive. But you come here, it's like chalk and cheese.
Yeah, 7 weeks to see a specialist here, and you've won out big. That's a great experience.
Well, look, I mean, my wife recently, in fact, we're today, while I'm here, she's there. She's seeing a specialist who was, she got her referral a fortnight ago, and then basically, in many cases, that's the way it works. People can see a specialist within weeks. Certainly, it's unusual, I think, to wait for a specialist more than a couple of months. But to hear about specialists, you're waiting a year or more, by which time whatever condition you have is probably a lot worse. It just beggars belief to somebody from my part of the world.
Yeah, for sure. So I don't want to take up too much more of your time, but we've talked a fair bit about this idea that you're allowed to choose between private or public. What are some of the other differences, maybe just bullet point style, between the Australian and Canadian systems that make Australia more efficient?
Well, certainly in terms of the raw numbers, in terms of proportion of GDP on healthcare, I think Australia is doing considerably better. I think we spend about 12%, and you're closer to 14. But look, I think the balance of public-private, not just in terms of hospital care, but I think also in terms of contributions, financial contributions, whether it's private health insurance or out of pocket. I think Australians are more willing to contribute that way. I think our definition of universality is different. The Canada Health Act is very absolute, or at least the way it's been interpreted, in terms of extra charging, as you call it over here. To us, extra charging is normal. Patient out-of-pockets are normal. But Medicare particularly, and access to free public hospital treatment if you choose it, is still a fundamental choice, a fundamental right. You have the right to choose it. Even if you have private health insurance, you've got the right to choose to go public if you so desire, or perhaps the level of care or surgery would justify it because public hospitals, public teaching hospitals have the capacity. I think we do well in particularly access to other health professionals as well, particularly dental care, and that's where private health insurance actually has a big role, because you can take cover for things like dental and optical, and even preventive things like physiotherapy, but also in terms of things like gym memberships, for instance. Health insurers actually cover that to encourage you to do the right thing by yourself. I think that's something that's a little different as well, perhaps, to Canada.
Bit of a focus on preventative, stopping the problem before it happens.
But certainly our health insurers, while they're far more extensive than here, are not American-style HMOs. We don't have US-style managed care. Effectively, they're informed payers. I mean, they use their data and very effectively, particularly in driving contract bargains with providers. But they also get a sense of what their patients need as a result of that. But they don't insist. In fact, they can't insist. They can't compel an insured person to do something in particular, and they can't compel a clinician or a hospital to take given courses of action or given courses of treatment. So I think that's a very important thing, because it does leave the doctor-patient relationship as the prime mover in the system. So you have a relationship with your doctor, not through your insurer, but directly. I think that's something that's very different to what happens in the States, and I think that's actually a good thing. And that's something I think that if you're looking at the definition of universality and accessibility and affordability in terms of the Canada Health Act, that perhaps a politically courageous government could actually have a second look and look at reinterpreting those principles in a way that's similar to the way we do in Australia.
Yeah. Okay. Well, I think that pretty much wraps up everything I wanted to ask you, Terry. Is there any final message, anything that you think Canadians should know or that we could learn from Australia?
Look, I think it's always good to talk about change and reform for the better, but I think it's also important to have the political will to actually make that change happen. And one of the things that struck me about Canada is that tampering with those Canada Health Act principles, tampering with the notion of universality as it's interpreted here, in terms of particularly things like extra charging, need to be tackled. They need to be taken on, and I think that doesn't matter whether it's a Liberal or an NDP or a Conservative government. I think that the time has come, particularly with the demographics that I think we all have now, with the boomer generation now coming to the high-end part of their lives in terms of usage, that we have to get the system right. And I don't think Canadians should be afraid of private sector involvement and making private contributions to their healthcare. I mean, the important thing in my mind is that when it comes to thinking about these issues, thinking about policy, that Canadians, that's not all Canadians, not just the political class, don't look south when it comes to looking at the private health system. Look east to Europe or look southwest to Australia, because I think there are good examples of how things can work there that don't scare the horses, and I think completely different to the notion of private healthcare as it's perceived from the United States.
Yeah, absolutely. Well, thank you so much for coming out, Terry. It's a long plane ride, and you're a bit jet lagged, so thank you so much for taking the time. I really appreciate it.
No, it's a pleasure, and I really appreciate Second Street inviting me to come.
Yeah. All right, thank you, Terry.
Thanks, Tom.